Hey, quiz time. What are the differences between stable angina and unstable angina?
Okay, so angina can turn into myocardial infarction. It's not a myocardial infarction. And it's considered chest pain. So stable angina is chest pain that is usually brought on by like exercise, so exertion. I think it lasts 15 minutes or less and can be relieved with vasodilators or rest. And I think an unstable angina is chest pain that has no cause. So it doesn't come with exertion. It's usually over 15 minutes and is not resolved with rest. With rest or vasodilation or vasodilators. And basically requires like immediate care. Is that right?
Yep, that's right.
Yay!
Quiz time. ECG interpretation. Okay, so no, I'm not giving you the answer. Show it back to me. Either torsade de pointe or ventricular tachycardia. Which one is it? Second one.
Ventricular tachycardia.
That's right.
It wasn't torsade de pointe. It looks exactly like torsade de pointe. Okay, thanks.
Quiz time. Women and older adults are more likely to experience blank symptoms during an MI.
Atypical symptoms, which is important for nursing consideration because it shows us nurses that not every person is going to have the same signs and symptoms and that they vary between people. So it's important to take these populations into consideration when assessing for possible MI.
Yep. Test time. Blank and blank are a clear way to differentiate between MI and angina. Bonus, list 3 of them. What do they indicate?
First question again?
Blank and blank are a clear way to differentiate between MI and
cardiac
angina.
biomarkers.
And bonus?
Is that right?
Yes.
What was the bonus question?
List 3 of them. What do they indicate?
Okay, so I don't remember troponin T, troponin I, and the other one I don't remember. I think it's like CK-MB, but it stands for like a very long name. I forgot it. Can you read it to me?
Creatine kinase isoenzyme.
Okay. And so I have to try and remember that one. But they all indicate that a myocardial infarction has taken place because those biomarkers are only present when a myocardial infarction takes place, and show that there's been like irreversible damage to the myocardium cells of the heart.
Mm-hmm.
Is that right?
Yep.
Yes.
Quiz time. Quiz time.
Oh, sorry. Sinus tachycardia.
By pixel. That didn't stop people from enjoying the internet. I mean, if you don't know any better, I guess
Yep.
it's not the circle of hell. However,
Hey, it's test time.
Yes.
Your patient is complaining of severe chest pain that moves to the jaw and down the arm. An x-ray confirms an ST elevation myocardial infarction. Anticipate the treatment intervention.
Okay. So the first method of treatment usually that's done and preferred method of treatment, especially in the acute phase in the emergency room, would be a percutaneous coronary intervention, otherwise known as a PCI. And essentially, as the name suggests, it is a needle and a viewing mechanism that allows for surgeons to put a stent into the blocked coronary artery and kind of puff up that stent to keep that coronary artery passageway open for circulation of the blood to reach the myocardium cells. And so that's usually the preferred method. There are also thrombolytics, IV use. So essentially, thrombolytics will be placed intravenously to prevent the formation of any more clots and try to relieve that pressure. And the third option of intervention, which is not always common, but it's known as CABG, which is a coronary artery bypass graft surgery, where a surgeon takes a graft from the person's vasculature from one part of their body and reconstructs it in the myocardium where there is that arterial blockage to create open blood flow. Is that right?
Yeah, good.